All right, we are going live. Welcome everyone to the CL Derm webinar series. Today we are on with Dr. Monica Boen for an open Q&A for you guys to get all of your questions answered right now by an amazing board certified dermatologist. I'm just going to give it a few minutes for some of you to join. I see a lot of people signing on right now. But while that is happening, I want to thank you for joining us. And I want to remind you that at the bottom of your screens, there's a couple features that you'll use throughout this webinar. So the first one says Q&A, and that's the best place to literally write in the questions that you would like Dr. Boen to answer. And then there's also one that says chat, and that's where you can send me a private message if you're having trouble, if you have a question about something that is not an official Q&A. So please utilize those features. While we're waiting for a couple person to come on, I am going to launch a little poll here. So you can tell us a little bit about yourself. So a little poll should have just come up. If you guys could please answer this, that would be fabulous. If you guys want to answer, that would be great. So we can just get a sense for who we are speaking with. It is very unique to be giving a presentation and answering questions for people that you can't see. So this will help us a little bit. All right, I'll give it a few more seconds. Okay, so let me close down this poll. Okay, I see. If you guys could just press submit. Give it one more second. Okay, so let's see. Only a couple of you answered, but that's okay. So are you a past patient? So it seems like a lot of you are, so you know us, so that's great. Some of you have attended an in-person event, some of you have not. Almost everyone found out about this from email. The two people that clicked others, if you want to chat me, I'd love to hear where that was from. And most of you are in sunny San Diego with us or in California, but we have one person from another state. And then what procedures have you had before? It looks like most of you have had Botox. A lot of, almost half of you have had lasers, and then less than half have had fillers and some of these other treatments. So thank you so much for that feedback. All right, so let's get started. So please start submitting your questions to the poll so we can start answering them. A couple have already come in, so let's get started. So thank you, Dr. Boen, for joining us today.
Hi guys, happy to be here. Hope everyone is safe and well.
Thank you. And so Dr. Boen is, of course, a board certified dermatologist. She's an expert in many areas of cosmetic dermatology, from injectables to lasers to body sculpting to anti-aging to veins, really anything under the gamut. She actually did her fellowship at our center under Dr. Mitchell Goldman. So she was trained by the best, and she's, very skilled and amazing if you've seen some of her results. So, and you can ask her basically anything today. She is also, a board certified dermatologist, so we are okay with some medical questions, but of course our specialty is cosmetics. And we are hoping that this is educational and informative for all the people tuning in. So here is the first question. Oh, this is a good one. Do eye creams really work?
That's a great question. I usually get that a lot from like family and friends as well. The first thing is that there's no magic in a bottle. So no cream is going to get rid of all your the wrinkles or crepiness around the eyes. That being said, they can work very well. So the skin under the eye is very thin. It's one of the thinnest places on the body, and it's prone to a lot of motion because of our eye movements. and direct UV light exposure and pollution. So it is one of the first places where you show signs of aging. And for this reason, you need a special cream for the eye as opposed to the rest of the area on the face. Things to look for in a good under eye cream are antioxidants such as vitamin C and plant botanicals. If you lack moisture in that area, usually using a good moisturizer like hyaluronic acid in that cream will help as well to improve the crepiness there. And if you have a lot of crepiness or wrinkles, using a mild retinol in this area will help strengthen the skin as well. And of course, you want to always add a daily sunscreen to that area and wear sunglasses to protect that area as much as possible. Let's see, I guess a lot of times I'm asked what are my favorite eye creams. I like the Neo-Cutis Biorestorative Eye Cream. It's a very good for sensitive skin. It has hyaluronic acid, growth factors. It's one that I use on a rotation. I kind of like to rotate a lot of my skin products. Another one is a SkinCeuticals HEE. Also has a lot of good peptides and botanical antioxidants. And when you put it on, it kind of gives you a nice little like sparkle under the eyes. It's very fun to apply. But another good value brand that you can get over the counter is the Neutrogena Hydro Boost as well, which is good for moisturization.
Fabulous. Thank you so much. That was a lot of great insight. And for anyone that would like to actually purchase or, use any of these products that Dr. Boen recommended, some of them are available online, but most of them are professional grade. So you want to make sure you're getting them direct from the manufacturer. We do sell all of these as well in our center. And right now we are available to safely ship, pack and ship any of these products to you. So if that's of interest. And we are offering 25% off all of our skincare just to kind of help show some support back into the community for what we're all dealing with. So, okay, let's see. Here is a good one. This is from Nina. Is it okay to use excess retinol from my face and hands on my chest, shoulders, and back?
I think retinols are a great product. It's been around for decades, and there's a lot of science and papers showing that it helps normalize collagen production, and reduce the signs of aging. It is okay to use it on all parts of the body, but just to be mindful, it can cause a little irritation reaction. So sometimes we'll do a little lower dose of a retinol on the chest and other sensitive areas. Usually on the face, I try to do as high as a concentration as patients can tolerate, because then you'll get a little bit more of that boost. On the chest, usually patients are able to use the same dose as on their face because it is maybe like a little less sensitive area. Though on the neck, I've noticed that patients like a little bit of a milder retinol because it can cause a little bit more irritation because the neck skin is a little bit thinner, has less sebaceous glands than on the face. But for the hands, usually I will say use the highest retinol that you could tolerate to get that best effect from the retinols.
Okay, great. I hope that was helpful. Here's another one. So what treatment would you recommend for a 55-year-old woman with an upside down smile, marionette lines?
We treat that a lot. I treat that a lot in clinic. I think the perioral area is one of the first areas that needs a little rejuvenation. So I usually do a combination approach. For the upside down smile is due to pulling of this muscle, it's the DAO, and the platysmal muscle. So if you relax that with a neuromodulator, such as Botox, Xeomin, or Jeuveau, or Dysport, you can then help create a more uplifted smile. Another thing to do is to add a little bit of filler in the corners of the mouth and marionette lines to help boost and add a little bit of volume there. We lose volume a lot around our mouth. And so putting a little hyaluronic acid filler, dermal filler around there can help support that area and give you more upturned and more even smile.
Great, thank you.
And it's really hard not to touch my face too. So I'm really trying to not touch the face. Okay.
I know that is the hardest things right now. Okay, so here's a good one from Mary. So what product other than sunscreen do you suggest for sun damage on the hands?
Yeah, that great question. So on the hands and chest, we see a lot of sun damage, especially in sunnier areas like in California. So for the sun damage on the hands, that you can use of course, sunscreen, but retinol or growth factors are also great too, to help build the collagen and growth factors and antioxidants, such as vitamin C. They actually help decrease the free radical burden that is a cause of UV damage, and help scavenge them. So that's a great way. We do a lot of laser treatments in clinic to help sunspots. So either picosecond or Q-switch lasers to target the pigment specifically, and then either a Fraxel laser or clear and brilliant, depending on your skin type, to help get rid of the background hyperpigmentation as well. And of course, definitely want to see a board-certified dermatologist. A lot of times they do find a lot of precancerous lesions or even skin cancers in the back of the arms. So you want to make sure that we're identifying the fact that it is in fact sunspots and not a skin cancer, in order to treat them effectively.
Thank you very much. All right, so let's see. Have you heard, this is from Nina, have you heard of Frau Knees? It's a tape for the face, old-fashioned way to smooth wrinkles.
Yes, I actually see them a lot now because we're all in quarantine. So there's a lot of those like face tapes. My parents have asked about it too. And what it does, there are a lot of silicone based ones, and it'll temporarily stretch the skin so you can get rid of like the 11's rinds and the crow's feet. So it could be a good temporary fix, but probably if you want more results like Botox fillers and then some lasers to help build and simulate collagen would be kind of a more like longer lasting approach for that.
Great. Okay, let's see. How often should you check your body for cancer or moles, and will lasers get rid of precancers permanently?
Oh, good question. So for each patient, I assess their risk, like how many sunburns have you had? Have you had tanning bed use? You have a family history of skin cancer, and that will determine your risk and how many moles you have. The more moles you have, the higher risk you have of getting dysplastic nevi, or of course, the biggest thing we worry about is melanoma. So I think at least if you're high risk, you should do a monthly self-skin check. You should be aware of all your moles. If any of your moles are changing, or if you're getting new moles, especially after your 30s, that's a concern, and you should see your certified dermatologist for that. And then usually I say at least a yearly skin check if you have those high risk factors, or if you're concerned about a new growing lesion. Another thing you can do is if you have a friend or partner, the best thing you can do is check each other's backs, because that's a place where I find a lot of skin cancers and you can't see your back very well. So that's a great way to have kind of a partner, a friend, kind of have each other's back, so to speak.
Okay, great.
Oh, and then lasers can treat some precancerous lesions, such as photodynamic therapy, or the Fraxel can help get rid of some of these precancerous lesions. You can get rid of some basal cells with a laser, though it hasn't been officially kind of FDA approved.
Okay, great. So here's a good one that I'm sure a lot of us think about. What helps with stretch marks? Are there any different treatments depending on the location of the stretch marks?
The stretch marks, definitely something I treat weekly in the clinic. It's unfortunately very prevalent, especially in females. So stretch marks can happen in adolescence when you're growing rapidly, and they can be, a normal sign, but can be very distressing to patients. It's predominantly females that it occurs to. And then of course in pregnancy, we get the stretch marks, unfortunately. So stretch marks are similar to scars. When we take a biopsy of a stretch marks and look at it under the microscope, there's a disordered structure of the collagen, and you get loss of the elastic fibers, which is why you get that kind of molted atrophic appearance. It's best to treat stretch marks when they first appear, so when they're red, then we can target them with a V-beam laser and hopefully normalize that collagen production. And then you can still treat the stretch mark scars when they're older. It just may take a few more treatments and have to do a few combination lasers, either with a Fraxel and V-beam, depending if they're white or red. And as I get asked a lot too, if I need to prevent stretch marks. Nothing has been out there in the literature. I know there's like a lot of anecdotal things, like retinols and other things to prevent stretch marks, but unfortunately nothing has been studied in a randomized controlled way to prevent stretch marks.
Hopefully that will come one day soon.
I know.
And if there is something, you guys can be assured we will definitely be the first testing it, because we have a full research center. So I'm sure we will have clinical trials going on for stretch marks. So
yes, we had one last year to treat white stretch marks as well, which is tough. They improve a little, but it's hard to get it 100% gone.
Interesting. Okay, let's see. Here's a good one. How do I get rid of wrinkles on my neck wrinkles?
Yeah, so neck wrinkles are common. I mean, even like millennials are getting them because we're looking at our phones, unfortunately, so it's tech neck. So one of the best things, of course, to prevent neck wrinkles is to have good posture and keep your phone kind of up, which is hard. I can't even do it. But usually I have to do a combination approach for neck wrinkles. First, we look at the skin quality. Is the skin thinning out because of sun damage and other factors? And usually you'll do a few lasers, either radio frequency microneedling or a Fraxel laser to help improve the skin texture. And if we actually have loss of volume, you can add a little bit of a light hyaluronic acid filler or a biostimulatory filler such as Sculptra or Radiesse to help boost the collagen and loss of volume there. And then lastly, you can use a neuromodulator. A lot of times we have this platysmal muscle, which is causing this band, and it pulls our neck down. And so you can relax that with a neuromodulator such as Botox, Xeomin, Dysport, or Jeuveau.
Beautiful. Okay. That one's okay. So there's two questions about kind of facial massages. So here's the first one. Is it okay to do a facial massaging with an oil or a nice cream? And how hard do you do it?
Yeah, I think that's a great question. And I know there's a lot of like the rollers out that people ask about a lot, but facial massage basically it'll kind of help clear your lymphatic system. And I think that's absolutely fine to do with like a moisturizer. And I would do more of like a gentle massage versus like a very rough one, just because you can then irritate the skin. You can do it yourself with just, using the hands. The Clarisonic brush is also a good way that you can exfoliate and then massage a little bit too at the same time. It's kind of a fun device to use. You can even use like a little, you can refrigerate a spoon and then kind of massage it with a cool spoon as well. It's a good way just to kind of get the more lymphatic drainage in the face.
Great. So then the other part of the question that you kind of just answered, I think, but does massaging your lymph nodes in the morning when you wake up help your skin, and how is it safe? Is it safe to perform lymphatic drainage massages on yourself?
I would kind of be careful not to too roughly or press too hard when doing the lymphatic drainage. In the wound care clinics, it's actually you need a special certification to know how to do the lymphatic drainage, and that is what we do to help wounds heal. But a light massage is not going to do anything bad. Just don't press too hard. And sometimes using like the brushes, there's the Clarisonic brush is more of a controlled massage, so you're not pressing too hard.
Okay, great, thank you. Okay, here's a really great question from Lori. Where are some unusual places that you put fillers that wouldn't be expected, such as I've heard of earlobes?
Yes, earlobes have been a big hit with filler. Just because we wear like the hoop earrings. I actually, fun fact, don't have my ears pierced at all. So hopefully I won't need filler in there. But when you wear like earrings and heavy earrings, it'll cause strain and it'll kind of deflate the earlobe. So we put it there. Another strange place is the elbow. So we have a lot of crepiness in our outer arm. And so you can put a biostimulatory filler to improve the skin quality there. And so you don't have that like crepiness there. Another thing, and we did study on it too, is above the knee, we get a lot of wrinkling there and the skin gets thin. So we can put a biostimulatory filler in around the knee to prevent wrinkling there. So that's like a few strange places we put filler in, but it does work.
Beautiful. Okay, let's see. This is from Renee. What is the best to eliminate fat deposit accumulated under the eyes? Please address putting fat back into the face so the fatty areas under the eyes are discontinued.
Yes, so usually when we have fat under the eye, it can be an infraorbital fat herniation. In that case, if that is the case, then I usually refer patients to go see a specialized oculoplastics in order to reposition the fat. That usually will need a special blepharoplasty by only a special, definitely I recommend someone who specializes only in the eye area. In terms of, you can sometimes with a CO2 or ablative laser, you can help sometimes melt a little bit of the fat, but usually it's more a skin tightening effect. So in that case, usually it has to be referred out.
Got it. Okay. What's the best treatment to rejuvenate the skin on the chest?
For the chest, so the chest is a special area. It gets a lot of sun, and we're really good. I know patients are really good about putting sunscreen on the face, but it's hard. We forget about our chest. And when we're driving a lot, the sun gets a lot of we get a lot of exposure on the chest here. So first of all, I would do a good skincare regimen, sunscreen, antioxidants, growth factors to help protect the area. And then I really like doing a combination of the Fraxel Dual and usually a picosecond laser to help with the brown spots. And then if sometimes you get a little bit of crepiness or the skin quality is decreased, so you can do a skin tightening treatment with Ulthera or Thermage in that area, which works well. We did a study where we looked a year after to see how patients did with after Ulthera, and they maintained that they had a decrease in chest wrinkles even after a year. So these results do work, and we studied all of these lasers and injectable devices to make sure that they do work so patients are happy. We're not kind of promoting something that is ineffective or not safe.
Okay, great. All right, someone asks, are any of these procedures covered by insurance?
I know, I wish, because I do medical dermatology, and I get asked that a lot by the medical dermatology patients, but we do not, these are not covered by insurance at our clinic. I would love if they could, because I love doing them, so I would love if they were covered.
Okay, here's a great one. So what is best to do for heavy wrinkles at the top area of the lips and around the lips? And what is best for deep wrinkles at the eyes?
I think my go-to, if you have the downtime, my go-to for the deep wrinkles around the mouth, around the eyes, will be an ablative laser resurfacing procedure. That is hands down the gold standard. It will help eliminate the wrinkles by at least 50%. And we've done numerous studies have shown great results. And you can do it safely around the mouth and around the eyes. The only caveat is that it is a 2-week downtime. And we have to monitor you really closely. But the results are amazing, and it takes 5 to 10 years off, and these are long-lasting results. But if we want to go kind of the more conservative route, you can do radiofrequency microneedling, which is a little bit less downtime, maybe 3 to 5 days, or a Fraxel laser to help build collagen in that area. Sometimes you can put a little filler in the deep lines, but usually you have to combine fillers with a laser procedure to get the results that you want.
Got it. Okay. This is a great one. So what skincare is clean and natural?
I get that question a lot too. There are a few brands now, more now than before, that are advocates for, they're vegan, they are organic, and they try to sustainably source. So Kula and Colory Science have kind of gone out of their way to make sure that they are a clean brand. But I just want to warn patients that natural does not always mean that they're safe and effective. There's still chemicals in everything, and poison ivy is natural, but we do not want to put that on our face.
Yeah, that's interesting. I don't really think of it like that.
Yeah, yeah. We have to be careful. Even if it's natural, you have to be careful and kind of read the ingredients carefully.
Okay. See, so what are some good exfoliators? Are there any skincare products you recommend or any at-home recipes for exfoliating scrubs?
I think now, now that we're at home, we have a little bit more time to care for our skin. And so I think at least once a week, it's good to have a little bit of exfoliation. Of course, unless you have sensitive skin or we have a rash or eczema, we have to be a little bit more careful. There are a few good exfoliators. There's the physical exfoliators with the scrubs, and there are chemical exfoliators. And so we, at our store here at Cosmetic Laser Dermatology, we have a lot of the chemical exfoliators. And so good ones that you can find are the Skin Medica, AHA, and BHA, which even have like little microscopic beads that help exfoliate the skin. But there's also really good affordable options that are over the counter. There's the 2% Neutrogena salicylic acid oil-free acne, which is also good for acne. And the Ordinary brand is also a very affordable option. They have this 7% glycolic acid toning solution that helps also kind of exfoliate. And after exfoliating, your skin looks a little bit smoother. And then if you want a really good exfoliation, I know Far's, our esthetician, does a really good job at exfoliating and making your skin look very shiny and pretty.
Absolutely. Okay, here's another one. I hear about Fraxel all the time. What is a good age to get that peel?
That's a good question. So the Fraxel brand name actually encompasses 3 different lasers. One is the 1927, the Fraxel Dual. That one is good for sunspots and superficial texture and pores. The next one is the 1550, the Fraxel Restore, which is good for acne scars and for deeper collagen remodeling. And then there's the Fraxel Repair, which is like the CO2 laser. So that is the more of the laser resurfacing. So those are very good, like aggressive lasers for sunspots, for rejuvenation, and for fully ablative rejuvenation. So those, people start depending on how much sun damage you have in your 40s and 50s. But a lot of patients, we start losing our collagen in our late 20s. And so there is a lighter laser than the Fraxel. It's called the Clear and Brilliant, which has 2 different wavelengths, and they're much gentler than the Fraxel, so you have very low downtime. One is for sunspots and one is for collagen building. So if you're just want a little bit of a collagen boost and you want to preserve and prevent wrinkles at an earlier age, you can do the Clear and Brilliant lasers. That's what I do. I do them about every 3 months. I rotate just one for sunspots and one for collagen building, especially around the eyes, around the mouth. I'm trying to prevent as much as I can now. And those are good for younger people.
Great, thank you. All right, and for those of you just joining us, please remember if you have any questions, you can pop them in at the Q&A at the bottom. We still have a few minutes left, so we can get in a few more if you want to send in anything that you're thinking, and you can submit it anonymously as well. So, you don't have to say who you are at all. Okay, so here's a good one. So what can I do for thinning hair?
So it's a big problem. So a lot of times, first we have to determine, is your thinning hair due to androgenetic alopecia, or is there another process going on? So definitely see a board certified dermatologist to identify what is the cause of thinning hair, because it could be thyroid, it could be vitamin D deficiency, a few other things. But in talking specifically about female or male pattern hair loss, you can start as early as in your 20s. And for men, they get more of the recession of the frontal hairline and thinning on the vertex of their scalp. While for women, they get a widened part, they get thinning. They usually don't have recession of their frontal hairline, but more thinning in a widened part. And maybe a little bit on the temporal area, we get a little bit of recession there. So probably one of the mainstays, and it's been around for a while, but it does work, is minoxidil or Rogaine. You start with that in order to preserve the hair that we have. It increases anagen phase and will help prevent any further hair loss. You do have to do it daily. because a lot of patients don't want to do that, but it does work. And even when you stop, you don't lose as much hair as people think. The next step is to make sure you have enough protein in your diet. It's really important. And then there are these, in the past few years, there's been a host of these vitamins. I was skeptical at first if they actually do work, but they've had pretty good studies. Even a lot of my colleagues, my dermatology colleagues, are using them, and they love them so far. So probably the best ones on the market are the Viviscal Pro, which is available in medical offices, and then Nutrafol, which is available online. And those help also stimulate anagen phase. They have plant botanicals and some have collagen to help with hair loss. The next step is platelet-rich plasma, or PRP, which we do in office. In this procedure, we draw your blood, we spin it down, and we get the platelet-rich portion, and it contains your own growth factors that we then inject into the scalp. And those are usually a series of 3 to 4 treatments over the course of a few months, and that has worked really well for the female and male pattern hair loss.
Hey, that's very informative. I think a lot of people don't often realize that dermatologists are not just doctors of the skin, but actually also of the hair and nails as well. So
yes.
Okay, let's see. What can I do with my jowls?
Yes, so the jowls are a good question, and a frequent question that we get. When we get jowls, because a few things. One, we have a ligament that supports our jowl that loosens with wisdom, and then we get descent of that fat pad that causes a jowl. Probably one of the best ways to get rid of it is doing the thermi-tight with microlipo procedure. And what that entails is we numb the entire area. We use a tiny little cannula to take out that extra fat from the jowls, and then we introduce a little probe that has radio frequency to tighten the skin around that area. That's probably one of the best things to do, other than a facelift. The facelift is probably still the gold standard to help remove the jowls. But at our clinic, usually it's patients who prefer to not do surgery, so we do the non-surgical approaches to help improve the jowling. Another thing to do too, if we don't want to do the thermi-tight and with the microliposuction procedure, is Ulthera Thermage can strengthen the ligaments that are loose due to and causing the jowling, and that can also is a more minimally invasive approach to help strengthen that area. And we usually do the entire jawline as well.
Beautiful. All right, we have time for just a couple more questions, so please submit. Here is one of our last questions for you. This is from Marissa. So is there any laser that could help prevent or slow aging or wrinkles and fine lines? Is it beneficial to start getting lasers when you're younger, and about what age?
I think we're realizing now more and more that prevention is the key. So that if we start earlier preventing wrinkle formation, sun damage, we don't have to do these crazy procedures when we're older. So in terms of lasers, usually probably in the 30s, depending how much sun damage you have. If your skin is looking good and I don't think there's anything that we need to do, I'll just say good skincare. We don't have to do any lasers yet. But usually in the 30s, we'll begin with a few collagen boosting lasers. One is the Clear and Brilliance, which are very gentle. And then probably Ulthera every other year to, Ulthera is a microfocus ultrasound in order to help lift the skin. When we age, our skin starts to sag. So an Ulthera or Thermage procedure, which are skin tightening procedures, will help prevent that skin sagging and kind of make sure that the skin is more lifted. Another thing to do, of course, is Botox. So I don't have any more Botox left because of the quarantine, but Botox is great to prevent those 11 lines, to prevent the crow's feet, and by reducing the dynamic motion of the facial muscles, you're not going to get the line formation. And then you don't have to do as much fillers when you're older. And this has been well studied too. There's a twin study where one twin had Botox, the other twin didn't have Botox, and the one twin with Botox looked much younger a decade later.
Wow. That's very interesting. All right, so let's do one last question. Okay, is a powder sunscreen or a lotion sunscreen better? And what are the pros and cons of each? And then I'll add my own little tidbit. Do we still need to wear it even though it's raining right now for those of us in Southern California?
There's so many sunscreen formulations out there, which is great. So the patients have more options. However, there was a study recently, it was about 100 patients where they were given a stick lotion, a powder, a cream, a lotion sunscreen, and a mousse. And then they checked how much SPF was actually on the face after application of the sunscreens. So it turns out, I wonder if you guys can guess, but the worst sunscreen was the powder one. Had the least amount of SPF protection from the powder. And then the best was actually the lotion sunscreen, where patients applied enough of it that they had the highest SPF. So that being said, if you're going in the morning, probably it's best to start with a lotion-based sunscreen to get the best SPF, because it matters how much you put on the skin as well, and that will determine your SPF rating. But throughout the day, it's hard to put on a lotion over your makeup all the time. So, you can use a powder throughout the day to reapply every 2 hours. And even when it's cloudy, you still get 70% of the UV rays. So if you're going outside and it's still cloudy, I would probably still put a little bit of sunscreen on just to make sure that you're protected.
Okay, great. All right, thank you so much. Well, we really want to thank all of you who joined on today. This recording will be available on Facebook and YouTube, and we will be emailing it out to you if you're on our email list on this weekend. After this webinar is closed down, you're going to get a little survey that pops up. We'd love your feedback because I know I keep saying this, but this is still kind of new for us and for everyone else. So any ideas or recommendations or suggestions you have, we would love to hear. Otherwise, we are continuing on with our webinar series tomorrow, Friday, with Dr. Wu. He's going to be speaking at noon on lunchtime lasers, which are basically the more non-invasive lasers like IPL and Clear and Brilliant. And then on Monday, we have an open Q&A with Dr. Fabi. Tuesday with Dr. Mitchell Goldman, all about leg veins. And then Dr. Boen will be back next Thursday, so a week from today, to give a presentation and show a lot of before and afters all about wrinkle smoothing and lip plumping. So I hope you all tune in for that. It'll basically be all about the Botox and the fillers, and all of your questions can get answered on that as well. And otherwise, thank you, Dr. Boen. You've been immensely informative, and I hope very educational.
Yeah, thanks for listening, guys.
Okay, great. So thank you all so much again, and have a great rest of your Thursday. Bye.
Bye, guys.